Okay, today we're going to continue with our first aid block of instruction, and we're going to be talking about first aid for common injuries. Okay, the essential question: how can you help someone with a common injury? And think about that. You've probably done this, whether it was for yourself or someone else, some of these common injuries. But it's important that we understand what dictates, a common injury and what may dictate something that requires further assistance or needs medical attention. So think about what you already know about treating common injuries, Band-Aids, that sort of thing. But we're going to go through the proper steps in order to treat common injuries today. Which of the following would indicate that an insect bite is a serious injury? The area bitten turns red and is swollen. Insect bites are never serious. They're minor injuries. The person bitten has difficulty breathing, or the insect bite is from a bee or wasp. And if it's a serious injury, it's going to be C, the person bitten has difficulty breathing. That would require definitely medical attention. They're having an allergic reaction. So we're going to talk about treating minor cuts, or treat and prevent insect bites, and how to treat animal bites, minor burns, removing objects from your eye, how to stop a nosebleed, and if someone has fainted, how to help them, and what requires further medical attention, and then our keywords. All right, we're going to go ahead and we'll do this game here. Test your knowledge on first aid common injuries. And that should be right here. All right, does Pat know first aid? We'll continue, proceed to the game. Show only 6 questions. Okay, Pat cuts himself on a tool in the garage. The first thing he does is put some antibiotic on that. Is that correct or incorrect? And wait a minute, gotta go back. That was incorrect. First thing you need to do is wash your hands. Sorry, I hit the wrong button. Pat twisted his ankle while running after his younger brother. It hurts, so he put a warm heating pad. Is that correct or incorrect? It's incorrect. You want to put cold ice on it, not warm. You want to put ice in order to decrease the swelling. Warmth would not help. Pat gets stung by a bee. He removes the stinger just as he would remove a splinter. Is that correct or incorrect? And that is actually correct. You want to, whenever you get stung by something, you want to try to remove that stinger because it's still injecting its venom into you. Pat is helping his dad cook some burgers on the grill. He gets a burn and rushes to put some cold butter on it. Is that correct or incorrect? That's incorrect. That's an old wives' tale. You want to go ahead and immerse that in cold water. Pat is hiking in a park and gets bitten by an abandoned cat. Pat cleans the cut and doesn't worry about it. Is that correct or incorrect? Incorrect. So you want to wash the wound up, but you also, if it's an abandoned cat, you need to probably tell your local animal people to get that because it could have rabies. Pat gets a nosebleed. He pinches his nose shut for 5 to 10 seconds and breathes through his mouth. And that's actually should be 5 to 10 minutes, not 5 to 10 seconds. So as it's written, that was incorrect, but it's a typo there. It should be 5 to 10 minutes. All right, continue with our presentation here. Okay, think about how you would treat some common injuries, and we're going to go through that in this block. Let's review first the first 3 things you should check for in an injured person. This comes from our last block. Does everyone remember when we're talking first aid injuries? It's going to be 1, check for consciousness. 2, check for breathing and heart rate. And 3rd would be check for bleeding. We should all know that by now after our last block of instruction. Okay, this is going to be an assignment in It's Learning. I want you to read about treating minor cuts, sprains, insect bites, and stings. It's only pages 159 to 163. Probably good to read the whole chapter, but we're going to go over the rest in this presentation. Okay, we're not going to do that. Okay, let's talk about animal bites. That's both pets and human beings, because human beings are animals. The big risk from those is saliva. That can infect the wound. So anytime you have a bite, you're going to control the bleeding. If you can, you should probably wash your hands first, then control the bleeding. Clean the wound out with water or hydrogen peroxide, and then bandage the wound with a sterile pad. And now be aware that bites from animals, you need to be aware if it's had its rabies vaccination. If you're unaware of that, then it could be more serious and you need further medical attention. And that can be very serious. Okay, minor burns. Basically, if it has no blister, that's kind of a minor burn. It's the outer layer of the skin. It's painful, swelling, redness may be present. Your first aid for that is you're going to put it in cold water for at least 15 minutes. And then once again, using a sterile bandage, go ahead and correct it. If it appears to be a deeper burn or covers a larger area, you may need to seek medical attention on that, especially if it has blisters. You wouldn't want to pop the blisters or anything like that. Okay, a foreign object to the eye. This is a pretty common one. Your natural instinct is to often rub your eye once you get something in there. Do not, do that. Resist the temptation to rub your eye. What you need to do is get, some sort of water, with a glass. Try to flush the object out of your eye with the clean water. Using a small glass at the base of your eye. Turn your head to the side. Keep your eye open. That's not a natural instinct, but you try to keep your eye open and pour that water into the eye and hopefully get the object to wash out. If you cannot remove the object, seek medical assistance. Also, if you have a buddy there, they could possibly pull your lower eyelid out while you look up, and they got a cotton swab. If it's down in there, they could try to get it out. Or if it's not down there, have them look down and pull your upper eyelid and see if it's in there to help. Okay, nosebleeds, very common. You get them from a cold, just dry air or injury to the nose. You want to sit upright and lean forward and then pinch your nose with your thumb and index finger, and then keep that pinched for 5 to 10 minutes. Like I said in that last quiz there, they had a typo. It should be 5 to 10 minutes. Keep it pinched in order and breathe through your mouth, and that should do it. If it keeps bleeding for longer than that, or there's a lot of blood, if it was caused from a fall, you should probably get medical assistance immediately. Okay. Fainting occurs when the brain's blood supply is cut off for a short amount of time. Sometimes older people, they get up and too quickly and they may cause them to faint. If you do, lie down, or if you do feel lightheaded, sit with your head between your knees in order to try to get the blood flowing back to your head. If it's someone, leave them laying down. Don't try to get them up. Make sure they're breathing. Check that airway. Loosen their tight clothing. You could possibly sponge some cool water on their face. And then elevate their legs in order to get the blood to become spooling back down to the brain. If a person remains conscious, does not regain consciousness in 1 to 2 minutes, you need to call 911. It's something more serious. If they lose their consciousness after a head injury, that's not fainting. That's a 911 call. Or if definitely no signs of breathing, you would call 911. Okay, the acronym RICE. In the treatment of sprains stands for rest, immerse, contain, elevate, rest, ice, compress, elevation, rest, ice, compression, Epsom salts, or reduce, immerse, comprehension, elevation. And if you do the reading, that would be B. You rest it, you put some ice on it, you can compress it, and then elevate it above your heart. That helps. You put antibiotic ointment on a minor cut you got 3 days ago. Now you have a rash around the cut. You should A, ignore the rash. It's just a minor irritation. Keep using the antibiotic ointment. It'll prevent infection, or stop using the antibiotic ointment. Anytime you get a rash after using the antibiotic ointment, you're going to stop using that antibiotic ointment. True or false, to remove a tick, Use nail polish or petroleum jelly. This is a very common, people say that. I've heard it many times. So, but it's actually false. You do not want to do that. You want to remove it, get pliers, and it's close to the skin of the head. Try to firmly remove it without losing the head. A classmate faints. You know he has been ill. It's been 2 minutes and he's still not awake. What should you do? Spill a glass of cold water and say to wake him up? Let him sleep. He really needs the rest. Call for help. He's been unconscious too long. We just talked about this. Should be, if you're listening, C, call for help. He's been unconscious too long. Okay, think about how you would respond to different situations. Okay, we're not going to do that worksheet. And get to the reflection there. Think about how you would remember the treatment for common injuries and the warning signs for when an injury may be serious. And that's what we need to be aware of. When is something that's common may be something serious? Like if a bee sting and they're having a hard time breathing, that becomes something more serious. Okay, let's go through these questions in order to complete this block of instruction. Allergic means having an abnormal physical reaction to something eaten, touched, or inhaled, cleaning infected wounds, becoming unconscious at the sight of blood, or being resistant to viruses and bacteria. And the answer to that is A, having an abnormal physical reaction to something eaten, touched, or inhaled. Allergic reaction. Medication used to fight infection is called an antiseptic, an antibiotic, anti-rabies, or hydrogen peroxide. And if it's fighting an infection, it's a B, antibiotic. Hydrogen peroxide is a virus or bacteria, a killer of viruses, an antiseptic cleaning liquid, or an ointment used on cuts. And the answer to that is C. It's a good antiseptic cleaning liquid to help you clean out injuries and wounds. Okay, type of tissue that holds bones together is called a ligature, cartilage, muscle, or ligament. And the answer to that is ligament. And those are the things that when you have a sprain, common sprains are your ankles or your knees. It's where your ligaments have been stretched and that's causing the pain. Or if you were to tear it, then obviously that'd be a more serious injury requiring medical attention. Blank is a type of virus that affects the nervous system and is usually spread through the saliva of infected animals. Is that Lyme disease, rabies, Rocky Mountain spotted fever, or scabies? And we were talking earlier about that. That's rabies. That can affect the nervous system, and that's a serious injury. Okay, guys, so how can you help someone with a common injury? That was our lesson question. It's a pretty short lesson today. We're able to get through it all. I know I went through it pretty fast, but a lot of what we talked about was in your reading. The rest of how to treat for the minor cuts and bleeding and all that, that's in 159 to 163. It'll be posted in its learning. So make sure you go through that, look at it. You can review this class again. Like I said, I wanted to get through this class today so that we could do this in one period. Do your reading, and we will follow up with the quiz on Thursday.